Hi, my name is Joanne Mejia, and my presentation is on privacy and security. I decided to do my presentation on privacy and security because although regulations have been in effect for quite some time, healthcare providers and staff still question themselves whether they are using the patient's personal health information according to regulations, even for routine care and treatment. The objectives are to understand HIPAA, privacy, and security rules, to have an understanding of security and privacy policies and practices, to comprehend understanding of privacy and security measures for patients, to understand how to prevent, identify, and report violations or breaches, to understand the risk of noncompliance. Privacy rule. HIPAA privacy rule establishes standards to protect patients' medical records and other personal health information and applies to health plans, healthcare clearinghouses, and healthcare providers that makes any healthcare transactions electronically. Next, the rule also requires appropriate safeguards to protect the privacy of personal health information. It does set limits and condition on the uses and disclosures that may be made without patient authorization. The rule also gives patients rights over their health information, for instance, to examine and obtain a copy of their health records and to request any corrections. Using and disclosing personal health information. Health information may be disclosed without patient's authorization in the following ways: if required by law, court orders, warrants, or subpoenas. To public officials, such as the FDA, regarding regulated products. For victims of abuse, neglect, or domestic violence. To help law enforcement officials, for instance, to help locate a suspect, fugitive, witness, or missing person. To notify of a suspicious death. Provide information for workers' compensation. Assist government actions, such as conducting intelligence and national security activities. Help with disaster relief efforts. To avoid a serious threat to health or safety. To health oversight activities for purposes such as audits and investigations necessary for oversight of the healthcare system and government benefit programs. Responsibilities. The HIM staff or anyone handling medical records has responsibilities in the way personal health information is accessed, used, or shared. Personal health information can be disclosed, but limited to what he or she needs to know. A good guideline to consider at all times is the minimum necessary guideline. Next, use personal health information according to HIPAA-approved guidelines for access, accounting, amendment, and restriction of personal health information. Another necessary responsibility is to only access personal health information to complete job duties. Most important is to maintain confidentiality and security of patients' information at all times. Security rule. HIPAA security rule establishes standards to protect individuals' electronic personal health information that is created, received, used, or maintained by any covered entity. The security rule also requires appropriate administrative, physical, and technical safeguards. Administrative safeguards to have in place are policies and procedures that must be followed by employees to maintain security. For instance, having a plan or policies in case of a disaster or in the use of internet and email. Technical safeguards to implement is to have assignment of the different levels of access, have devices that have the ability to scan ID badges, Also perform audit trails to monitor employees' activities and actions. Physical safeguards could also include to lock doors, monitor visitors, and secure unattended computers. Protecting electronic personal health information. How to apply the security rule. Applying the security rule to the internet use by accessing only trusted and approved websites. Also, not downloading unauthorized programs to any workstation. Email should be kept professional and used only for work purposes. Any emails or attachments received that seem suspicious should not be opened, especially if the sender is unknown. The organization should have a policy for sending secure emails. How to control electronic personal health information access. Electronic personal health information should be controlled by having usernames and passwords in place for all users. Another control would be to have screensavers or automatic log off while the computer is idle after a certain time. HIPAA violations. There are 3 types of violations. First, incidental violations occur even if the necessary steps are taken to safeguard a patient's information, and a visitor happens to overhear or see personal health information. Accidental violations are when a person mistakenly discloses personal health information or provides confidential information to an unauthorized person. Intentional violations are when a person ignores the rules or deliberately uses or discloses protected health or confidential information. Breach. Breach is the access, use, or disclosure of unsecured personal health information that is not permitted by HIPAA privacy rules, and it compromises the patient's personal health information. Personal health information can be in any form, including electronic, paper, or oral. This is unsecured personal health information that is not secured through encryption. Another breach is the unapproved destruction process that renders the personal health information unusable, unreadable to unauthorized individuals. Investigate and report a breach. When a breach is reported, an organization or covered entity must conduct a risk analysis to determine whether a personal health information has been accessed. The investigation should determine the extent personal health information was accessed. It should also determine the person who accessed the unauthorized health information. Reporting a breach. Individuals should be notified by mail or email within 60 days after the breach is discovered. Breach notifications vary based on whether the breach affects 500 or more individuals or fewer than 500 individuals. Organizations and HIPAA penalties. The organization must develop a policy with the information to report, investigate, and sanctions that will be implemented in case of a breach. The sanctions should also be documented as corrective or discipline action towards employees. HIPAA has their own violations, and a few factors are considered. The length of time the violation was allowed to persist. Another factor is the number of people it affected and the nature of the data that was exposed. Also, an organization's willingness to cooperate with the investigation is also taken into consideration. Another one is also the prior history of the organization. For instance, is this their first violation? So this concludes my presentation. I would like to say that taking all this information into consideration, it is important to maintain confidentiality and security of patients' information at all times. to be able to provide the patient with the best quality care and treatment. Thank you for listening.